Hello, everyone. Happy Monday. I'm Rendy Murphy, epidemiologist and Director of Disease Surveillance and Environmental Services here at the Mobile County Health Department. We're here to give our daily update on the COVID-19 pandemic and its effect on Mobile. Worldwide, we have about almost 2.5 million confirmed COVID cases. United States, over 750,000 with over 35,000 deaths. In Alabama this morning, the Alabama Department of Public Health was reporting 4,961 confirmed cases, 165 reported deaths. And in Mobile County this morning, that live dashboard was showing 671 confirmed cases in Mobile County residents with 32 reported deaths. 18 of those died from illness. The storm last night did knock some servers offline in Montgomery, and there was a delay. There has been a delay in getting the most up-to-date numbers for you. So I did not publish a report today, but we'll have those available to you for you tomorrow. I did want to comment that yesterday marked 1 month since the first Mobile County resident with COVID-19 disease was reported. And today the Alabama Department of Public Health is reporting 671. This unprecedented pandemic is testing our resiliency as a community, and we urge your patience and continued compliance with state and local public health directives to protect our most vulnerable community members from adverse outcomes and slow the spread of this illness in our community so that we don't overwhelm our healthcare system and hospitals. So I have just a couple of announcements. I'll answer a couple questions today. Our health officer just walked in, so he has something important to say as well. I just wanted to remind you that the Mobile County Health Department and the Family Health, our primary care division, have expanded operations starting today. And I just want to make sure that you have this information. So we will resume modified operations today at our 8 Mile Health Clinic located at 4009 St. Stephen's Road. The site will be open Monday and Thursdays from 7:30 a.m. to 4:30 p.m. for children between the ages of 1 and 5 years old. Again, that's for children 1 to 5 years old. This is separate from our WIC services, which is handled slightly differently, and Pebbles King will talk about that in just a minute. Our Newbern Clinic downtown this is not where we are now. Newbern Clinic at Cox Street, 248 Cox Street, is still seeing well babies on Monday and Thursday from 7:30 to 4:30 p.m. That's our Newbern Health Clinic at 248 Cox Street for well babies, patients 12 months or younger for well child checks. OB services and limited family planning service is offered at the Women's Health Center directly behind the Newbern Health Center. Again, Mondays and Thursdays, 7:30 to 4:30. Urgent care at our Keeler building here downtown is open Monday through Friday, 7:30 to 4:30. And we have drive-in COVID testing of symptomatic patients here now at our downtown Keeler location, Monday through Friday from 9 a.m. to 3:30 p.m. And again, we have opened this up to anyone in the county who meets the criteria for testing, and you don't have to be a family health patient, and this is regardless of your insurance status. So if you have symptoms of COVID, call our triage line, our info line rather, 251-410-MCHD, or that's 251-410-6243. Call the number. You have to have an appointment. They'll ask you a couple of questions, like if you have fever, cough, or shortness of breath, and anyone can get testing at the Mobile County Health Department at our downtown Keeler location. Dr. Eichel?
Yes, thank you very much, Dr. Murphy, and good afternoon to everyone. In regards to COVID-19 data, just for clarification, this is a reportable disease, the Alabama Department of Public Health, and we are the custodians of records. So the official reports that come out by the Alabama Department of Public Health, your Mobile County Health Department, are considered the official source of data. There will be slight changes. There's some real-time data that's coming in, but for the purposes of tracking, that I would encourage everybody to look at that source. Next thing that was brought up to our attention were testing supplies, and just to clear the air, when this originally started a month ago, the Church of the Highlands is a private church in Birmingham that had access to 2,200 testing kits. And that's was not a government agency, was not the Alabama Department of Public Health, Jefferson County Health Department, university, or any other source that did the original volume of testing that caused everybody's noticed in the news media. Right now, we have testing sites that you can look at the Alabama Department of Public Health website for testing sites, and they're not being overwhelmed by testing. But again, we want to test individuals who need the testing. At the Mobile County Health Department site, there is no charge if you do not have an ability to pay. We will file insurance if it's available, but again, Mobile County Health Department, 251 North Bayou. Other personal protective equipment is still in short supply, and proper wearing of PPE is extremely important. So please, if you're going to wear face covering, do it properly. It does no good not to have it worn properly, and this is something new to a lot of people who have not routinely worn covering over their face except during carnival, and this is not a time that we want to get it wrong. So please, their websites at the CDC about proper protective equipment or wearing face covering. And the other thing is the national stockpile of personal protective equipment is exhausted. So right now we are dealing with finding personal protective equipment on the open market. Some governors are working together as an entire state. But so if you have some mask, medical mask, and not a medical professional, please consider not using those just as you go out retailing, but pass those on to a healthcare provider who can use it to protect themselves. Many of our healthcare workers are becoming infected with COVID-19, and we want to protect them, but use the proper cottage industry covering for yourself. And as we go forward, please everybody know that we thank you for working hard, taking this seriously. This virus is still taking lives in our community. We're still getting new cases each and every day. So please, please, please be cautious as we move forward. And I'd like to turn it over now to Pebbles King. Thank you.
Hi, Pebbles King, Bureau Director of Community and Nutrition Services with the Mobile County Health Department. In reference to a question last week to reopening our community, the Unified Command, which includes principals, representatives from Mobile County, City of Mobile, and the Mobile County Health Department, received the White House and the state guidelines for recommendation on reentry into our community. The Planning Committee of the Unified Command has the documents to review and has already created a recovery planning team, which will develop a plan that supports reopening Mobile County. Regardless of reentry and reopening of facilities, we should all continue to practice social distancing because there is no cure or vaccine for this virus. We should continue to practice the 6 feet social distancing, wearing our face coverings when returning to work, as well as normal day-to-day activities, while being respectful of others' personal space. We must remember that we are all in this together, and we must continue to protect each other by doing our part to protect the entire community. In reference to the Mobile County Health Department's WIC site and locations, the Teen Center Clinic located inside the Newman Health Center at 248 Cox Street, across the street from USA Children's and Women's Hospital. Pickup is from 8 to 4 p.m. Monday through Friday. That does not change our hours at that location, even though we have now the new operating hours on Mondays and Thursdays at our 8 Mile Clinic for primary health. We look at this and we understand as far as that we're here to support your families, and we look forward to supporting you in any questions that you may have.
All right, thank you, Pebbles. I have a long list of questions here that have been either submitted on Facebook or by the media, and I will try to get to several of them. One question that we are starting to get a lot is requests asking me to provide more information on the outbreaks in congregate settings that we have going on around the county. So we do work with nursing homes, long-term care facilities, detention centers, locations that have people living in very close quarters. We keep a sharp eye on patients or employees or visitors of those locations who test positive for COVID, because we know in those closed settings where residents are living close together and the staff are working around the facility, we know that transmission can accelerate in those facilities. We worry about this in normal times, not just during a COVID pandemic. We have several long-term care facilities that have multiple cases in their residents and multiple healthcare workers that are affected. We are working really closely with them to help them slow the spread, and we're also talking to our long-term care facilities who currently do not have COVID positive residents or employees, so that we can provide them with tips and lessons learned to help them keep coronavirus from entering their facility or getting a foothold there. I will answer one question directly about a report that a resident who passed away, that her family didn't know that she had died of COVID until they saw the death certificate. And that situation is unfortunate and was simply a clerical error on the death certificate. And when it was recognized that this had happened, the facility reached out to the family of that resident and talked with them and explained the situation. And I think that the family was very appreciative of the nursing home for everything that they had done for their loved one during that event, during her time being cared for there, and was just a small clerical error that resulted in the family being told that the patient died with COVID when that indeed was not the fact. So I do want to straighten out some social media maybe on that. Let's see. Lots of questions about positivity, the prevalence of the virus in our community. The word prevalence means, how many people at any one time have the virus in Mobile County. And this is a very difficult number to get at because this is a brand new virus. We have limited methods by which we can determine if someone is infected or if they have been infected in the prior weeks or months. So it's not easy right now to determine what the true prevalence of the amount of infection in our population is. We can do some things like look at the total number that tests positive and divide that by the total number of tests performed. But we know that number of tests performed is woefully low, because we know that a lot of negative test results are not making it into our state system. So even if you do the math on that and you see that we have 600 and some cases and 3,600 or so tests, and do the math and it comes out anywhere between 18 and 20% depending on what day, I don't think that's the true prevalence in the community, because we know that there is PCR testing coming back negative that is not being reported to us. So please sort of again, beg your patience as we continue to learn more based on the information that we have. Also, the testing has been mostly done in the people that meet those risk categories. So people who are symptomatic, who have underlying conditions, or over the age of 65, who are healthcare workers, or who are ill and have no other explanation for their symptoms. So that can also skew the findings a little bit. But we do know that there is a lot of asymptomatic infection with COVID. A few weeks ago, I wasn't saying that because we didn't suspect that there were asymptomatic or pre-symptomatic infections, but we know from the healthcare facilities that have been affected, from what's happening in the community with the testing that's going on, that it is very likely that we have community transmission by people who are infected but asymptomatic or have very mild symptoms that they don't even think about as relating it to COVID. So this makes it extremely difficult to try to detect and control the disease in places like a nursing home, well, in any place, but particularly in a nursing home. So these are the reasons that we still continue to push the public health measures of staying at home, staying away from people if you're sick, washing your hands, not touching your face, disinfecting surfaces, things of that nature. Let me look here and see. So there have been a couple of questions about a change in the way Alabama Department of Public Health is counting deaths. And yes, I understand that this has almost been worked out, and yes, it's going to result in a jump in the number of our deaths in Mobile County. Without going into detail about the change, prior to the change, there was a fairly lengthy process for reviewing a death report as to determine whether or not it was related to COVID disease. So if you're working in the healthcare community, for every patient who was reported deceased, we had to obtain their face sheet, their history and physical paperwork from their medical record, their lab result, and their discharge summary. And that discharge summary, when someone dies in the hospital, it takes some time to get that ready for it to go out. So one important change is that going forward, if someone has a positive laboratory result and then dies, we're going to count them as dying with COVID disease. I know this seems like it probably makes common sense that if they had a positive lab test and then they died, that they died at least with COVID, even if they didn't die from COVID. But that's one big change that we hope is going to reduce the delay in getting deaths reported. I spoke with a very concerned hospital official on Friday who was really concerned about underreported deaths, and we worked together, and I worked over the weekend to try to determine where the delay or the underreporting was happening, and we worked with Montgomery, the state health department, to try to work through those methods to try to, again, reduce that gap both in the delay and the underreporting of patients who die with COVID. Let's see. Pebbles, you covered several of these. So all of the planning questions are going to Pebbles from now on about what we're doing around Mobile to try to think about reopening things. Someone asked about the fact that we only had 3 cases reported on Saturday. I'm not sure what the reason is behind this. It could be that laboratories are starting to return to normal operations Monday through Friday, but then we had a ton of test results come in on Sunday. So there went my thought about maybe it being a closed lab. So I'm not sure why only 3 were reported on Saturday. But it's an important point to remember that, we are providing the number of cases by day based on when they're reported to us. And that doesn't have anything to do with the biology or their natural course of illness. So, based on that report date, it's just information that we've been accustomed to getting, and we use that to have some idea. But behind the scenes, we are looking at illness onset dates, hospitalization dates, deceased dates, to see what the patterns are looking like in the community. And as I learn more about that, I will share it with you. Anything on Facebook? All right, I think that's probably about it for today. So thank you for listening in. Remember, if you have symptoms of COVID and you have no other option for testing, come on down to the Mobile County Health Department at 251 North Bayou Street, and we'll be happy to provide that test for you here. Thanks, and we'll see you tomorrow.